Hello, everyone that is joining us from the waiting room. We'll get started right at the top of the hour. Thank you, everybody that is joining us from the Zoom waiting room. We're getting our Facebook live stream set up and we'll get started in just 1 minute. Thanks so much for your patience. We're just waiting for the live stream to set up and we will kick off in just a minute. Thank you to all 96 of you who have joined us. Perfect, and we're now broadcasting live on Zoom and Facebook. Thanks so much for tuning in to the American Ambulance Association's first ever advocacy-focused live stream. I'm Amanda Reardon, Vice President of Membership, and I'll be your moderator today. This session is being streamed to both Zoom and Facebook Live, and is also being recorded for future playback. Our intention is for today to be highly interactive and driven by your questions, so please don't hesitate to engage with our hosts. Zoom attendees, please use the Q&A function to submit questions. Q&A is represented by the double speech bubble icon. Facebook attendees, please enter your questions in the comments. The Facebook broadcast lags behind real time by about 20 seconds, so we do appreciate your patience. If you're joining us from Facebook, please feel free to share the stream and share the information with fellow EMS professionals. Our panelists will cover American Ambulance Association's top advocacy priorities today. I'll do my best to curate and consolidate your questions, then ask them as we pause at the end of each discussion. We've also held significant time at the end for additional questions. The panel today is very distinguished, and a formal upfront introduction process for this group would take more than our allotted 1-hour runtime. Instead, we've asked our panel to introduce themselves the first time that they start speaking. With that, let's jump right in. Secretary Randy Strozyk, would you please introduce yourself and share some context with our attendees?
Sure. Hey, good morning, good afternoon to everyone. I'm Randy Strozyk. I'm the Secretary of the American Ambulance Association and the Senior Vice President of Executive Operations at GMR, the parent company of AMR. I want to kind of launch off today on the big picture of the fact that there is no doubt that the last 4 or 5 months for all of us have changed our lives drastically. How we respond, how we've been impacted, our various operations, and many of us individually. You know, we've had lives lost, we've had hearts changed, we've had families dealt with, and we've done amazing things. So I want to speak to today just real briefly, and I'm going to flip off to the rest of the group about the association. You know, we had to pivot very, very quickly and find new means of getting our message out there to America and to their electeds, to Congress, to everyone to show what we're doing. And every day we're all responding to doing calls and just doing many different things. But the impact has been huge. We've had huge increases in our cost of operation. We've had to explain the fact of the impact of cost of readiness, which is sometimes is forgotten. It's not so much the cost of doing the call, as we all know, it's the cost of being ready to do the call. And be it a 911 call, be it a non-emergent transport to move a COVID patient from a tertiary facility to a secondary care facility. It's been the impact of care facilities across the country having large exposures to COVID, and we having to deal with that. And then we've had to train our people to do new things. And first of all, for the first time that I can really imagine, and I came from the days when HIV was an issue, and then various things, H1N1, Ebola, whatever else, we're sending our people out to do the job where they're actually putting their life truly at risk. And we've had to deal with that. And you know what? They've responded, and they've been there, be it New York City, New Jersey, be it the South, whatever else. So today our group is really going to talk about a number of key factors that our association has done to make a difference. And I couldn't be more proud of what we've done. For us at GMR, we've lost 2 lives, and we've had, my gosh, close to 400 of our people get COVID. And I'll bet you everyone on this call knows someone has been exposed to someone. And every day you go do your job and try to hope that you have enough funds as volume dropped and cost went up to deal with it. So I think we're going to talk today, and I know we're going to explain today some great things we've done to make this happen. We've had the great honor of bringing the Mercury Group on board to help the AAA and help all our members and help EMS across the country get the message out, both in terms of congressionally and to get the message out into the public. And I know you've seen many of the articles, and we always like to mean, Hannon Cohen from Empress is our new hero. Not only did he get COVID, which I probably HIPAA violation, but he'll get over it, but his service and Jim O'Connor and those folks have done an amazing job, and we can run through the whole country. So I think I'd like to turn this over to our group, not take more of your time, but please know that our heart is out to everyone, and that we could not be more proud of what you've done. And to the members on this call and our experts, our huge thank you. So with that, I would like to turn this over to Jay from Mercury to introduce himself and talk about our exposure that we've done and how important that's been. Jay.
Hi, Randy. Appreciate it very much. My name is Jay Chabria. Yeah, I'm with Mercury, and Mercury is a full-scale public affairs firm, and what we really do is we try to change public opinion very strategically, and we've been very honored to be working with AAA for the last several months to try to help you do that, and you'll hear from a few of us today. So my name is Jay Chabria. I'm a managing director of Mercury, and at one point I was senior advisor to Governor John Kasich in Ohio, and I've been a veteran of a lot of different campaigns, presidential, gubernatorial, and congressional. So I wanted to take a moment just to tell you about a little bit of how we've engaged with AAA and how we're trying to really help move the needle. We've had a public affairs campaign where we're trying to impact Congress, trying to impact congressional leaders to change public policy for your benefit. And what does that mean? That means increasing PPE. That means trying to help with treatment in place and a whole host of other issues. And what I'll say is we've done a lot of public affairs campaigns, and because of what you do, and when we explain the message correctly, our numbers are through the roof. People are on your side, they want to help, and this is the general public. These are people that don't necessarily even understand how EMS works. So I'll just run through very quickly some of the numbers. You know, in the last several months, we've had 32,000 new advocates that we've cultivated, and that's all for AAA now to lean on them for future campaigns. They've had 50,000 emails go to congressmen and congresswomen and senators all across America, and there's been over almost 14,000 phone calls placed in these offices. Why does it matter? It's because at the end of the day, every congressional office, they do a tally. They look at who's called on what issues and what is important to their constituents. And then they tell their bosses. And that matters. That's how you move legislation. You know, lastly, I want you to understand that, you know, the issues that you deal with every day, they're super important to you, and you know them inside and out. But the general public doesn't necessarily know how EMS works. And I can tell you right now, most legislators, most congressmen, most senators, they don't really understand how it works. So it's really important to educate them. And finally, you know, we're just proud to be on board here. And one of the things that my ask of you is to try to get your friends, your family, the people that your employees, call your congressman, call your senator, email them, tweet at them. It matters. It really matters. And I know we'll talk a little bit about how the tools that AAA is providing for you to do that easily, but don't ever underestimate your ability to advocate on your behalf. It really does matter.
Hey, Jay, thank you. We're honored today to have Senator Vitter, who is from the Louisiana area and now works with the Mercury Group. And we've asked Senator Vitter to just speak a little bit about the view of Congress today as we see and to go forward, and to kind of give us his insight as to what we can expect between now and the presidential election in November 3rd. So, Senator, again, thank you for being on with us this morning.
Thank you, Randy. I'm David Vitter. I'm a partner with Mercury Public Affairs. And as Jay mentioned, we've been very proud and excited to be working with the association through GMR on all of these issues. Prior to joining Mercury, I was 2 terms in the US Senate as a Republican representing Louisiana, and before that, 3 terms in the US House. I thought I'd give the big picture of where things stand with Congress and the administration right now. This really is an unprecedented pandemic and crisis. And so Congress, just like everyone else, is taking it a step at a time, a day at a time, and often it changes every day or every other day. Right now, Congress has passed, the president has signed into law 3 major, huge bills related to addressing COVID-19, and they're now considering a 4th bill. And the goal is to pass that 4th bill by the first week in August, which is when Congress would normally go off to an August recess. That, at this point, seems like a very ambitious goal because different elements, even within the Republicans, for instance, are pretty far apart on what should be in this 4th bill. The Democratic House has already acted and passed the so-called HEROES Act, a $3 trillion program. Senator McConnell, the Republican leader of the Senate, wants to focus in a much more narrow way on a much smaller bill, and his probably top priority is liability protection. But even the Trump administration has different priorities. They are pushing a cut to the payroll tax. And then you have other controversial and uncertain issues out there, what to do with unemployment benefits, some of which start phasing out in a few days. Also, aid to schools to try to get them to reopen in the fall, but then that's controversial. Many Republicans want them to reopen, many Democrats do not. So all of that is to say that the parties are pretty far off gelling around the details of a 4th bill. The goal is still to pass that by the first week of August, but at this point that seems pretty ambitious. Of course, we are advocating for important priorities for the association, like aid to reimbursements that you all will feel, like adequate PPE, like treatment in place, which is more important than ever to stop the crush on emergency rooms, like getting DHHS to disperse the billions of dollars they already have in their coffers, which have not been fully dispersed. So we'll continue to advocate and try to shape this next bill with those key association priorities in mind. Hope that gives you some sense of sort of the big picture with regard to Congress and the Trump administration.
Hey, thank you, Senator. We appreciate that. You know, we all have 1,001 things we're doing with our job day to day, but I want to reward and I want to acknowledge 2 folks that I think, besides being 150% tied up with their own work, have been instrumental in our government affairs. So I'm going to introduce Jamie Pafford-Gresham from Pafford Ambulance and Asbel Montes, who most of us know that if you watch Facebook, Asbel, I swear to God, he's running for senator or something. So to talk about our direct funding issues, but I do want to acknowledge the hard work they've done. So Jamie and Asbel, please.
Thank you, Randy. Well, as he said, I'm Jamie Pafford-Gresham, and I am the current Government Affairs Chairperson for the American Ambulance Association, as well as a board member for the association. But my day job, 24/7, 365, just like all of you guys, is ambulance. And my family actually has ambulance services in 5 states, and pretty much we know firsthand, just as everybody on this phone does, is how it's affecting us on a daily basis. And I tell you, our company and our crews and our boots on the ground have struggled with every aspect of this, but they have just rose to the occasion each and every time that we've asked something for them. So, from the American Ambulance Association standpoint, we know that we are focused on making sure that we can find funding opportunities to ensure that our EMS services are included in as many opportunities as we possibly can across the board. And as the Senator said, there's billions out there that haven't been earmarked. And it's our goal to make sure that they find our ambulance services across America and properly reimburse them for this time period and all of our extra expenses. When you think about the $50 billion distributed to healthcare providers in the beginning, EMS systems receive less than 1/10 of that. And there's conflicting, tabulations of what the amount really is, somewhere between 270 million and 500 million, but whatever number that is, it wasn't enough. And it just barely scratched the surface of what we really need to continue to be the healthcare safety net across America. And so the association has determined that our industry needs about $2.89 billion to offset our lost revenues and our increased expenses, as well as uncompensated care. And as we advocate for the additional funding, specifically for EMS, it's going to be difficult with Congress has to act on this and not just give HHS the money. We really want them to make sure that they instruct them how to distribute it as it goes forward. And, Asbel, I know that you spend more time on the Hill and on the phone, really now. It's on the phone, which that is somewhat of a blessing. You can talk more in detail about how that money is possibly coming down and the amounts that truly are out there.
Sure, and thanks, Jamie. And I'm Asbel Montes, and I'm the Senior Vice President for Strategic Initiatives with Acadian Ambulance Service. And we're headquartered in the great state of Louisiana, like Senator Vitter. Richard Zuschlag is our chairman, CEO, and also one like Jamie, Richard and her dad, was kind of some of the pioneers of EMS in the systems as well. And also I do chair the Payment Reform Committee for the American Ambulance Association. So lots of work going, as Jamie just indicated earlier, especially with the CARES Act and the funding that's been distributed either through Health and Human Services or through the U.S. Treasury, as it deals with what they call the coronavirus fund. That's the state and local funds that most of you know about as well. And I better start my timer because I've been given strict limits on making sure it's less than 90 seconds. And so really, guys, if you've been watching and you've been following a lot of the webinars from the American Ambulance Association as well, there has been so much advocacy work that we are doing because, as Jamie indicated, they are treating us like budget dust, like we like to say. So a very granular number, a granular percentage of the overall funding that's been distributed has gone to EMS, and so we need to change that. Huge delta in the cost to the lost revenue that our industry has received as well. And so as we continue to keep advocating for that, we are getting traction with the leadership of Health and Human Services. AAA has been doing yeoman's work there, and we're continuing to advocate for that, as well as the additional $2.89 billion funding that we do need to move directly to EMS and sooner rather than later as well. So I'll turn this back over to you, Randy, because I think I'm within my 90-second allotment.
You are. So before we leave this for just a moment, let me query up both to you and Jamie and to Senator Vitter, everyone. What is your insight and feeling now that that our work so far may see resolution in COVID-4, and or do we think that HHS may release additional funds? What are the tea leaves reading us? And so if I could, I'll turn to Senator Vitter first, and then I'll go Jamie, and then Asbel, your batting cleanup.
Great, Randy. One of the things we've been doing is urging individual senators and representatives to call in to HHS, to talk to the secretary, and urge them to release more of those funds specifically for the ambulance industry. And there have been many who have heeded our request and made those calls. So we're hopeful that will make a positive difference. But as you've noted, it's been very slow in coming. There are still tens of billions of dollars not yet distributed from HHS. There's some feeling that they're deliberately slow walking some of that so they don't run dry and encourage another huge appropriation of funds, which some in the administration don't want. But we're urging them to get rid of that money, particularly where it's needed, like the Ambulance Association. Then there is the prospect of an additional appropriation through the next COVID-19 bill. I think there will be some significant additional healthcare dollars, but Congress probably is going to prefer to not target that very narrowly, but like in the CARES Act, give it to HHS with rather broad discretion so Congress doesn't have to choose between different providers.
Jamie.
Well, as everybody can only imagine, everyone has their hand out, and whoever hollers the loudest basically is getting something thrown out there. And so it's up to everybody on the phone to really be very active in how this next step is fulfilled. And with that, I think we have a great argument. We are first line, first responders, front line. You can call us anything you want, but we are right there where it's at. And that story resonates on Capitol Hill. But I can go in those offices all day long, and Asbel can make phone calls, and Tristan can do the same thing. But if you guys out there have not contacted and talked to your local delegation during this period of time, you're behind the 8 ball. And the people who are making the noise are the ones that are being heard. So that's what's going to dictate what happens next. And we've been doing our work, but it's going to take you guys to do the same thing at a local level, and them hearing from their local ambulance service how it's truly affecting you. And don't get tied up in the PPE conversation. They always want to give you more masks and things like that. That's not what this is about. This is about those billions of dollars that are set over to the side, and we only want 3 of them. I mean, I think that's an easy ask and just to say in that. So it's up to you guys how the next tranche is given out to us.
Asbel, let me change your question just a quick bit here, and then we'll go on to our next topic, which I don't remember the heck it is because we've been talking all day. Name 2 or 3 things that you think are incredibly important on this issue of direct funding that our members need to do now.
Number 1 is, and I'm going to reiterate what Jamie just said, you need to be calling your local delegation, whether it's your local senator or your congressman. And that is key to this, because as somebody from Washington leadership was telling me, is they are hearing from every CEO and from everyone, not just trade associations. And so the louder the noise, like they say, the squeaky wheel gets the grease. We need to be a very squeaky wheel, and that needs to happen on the local. The second thing that you need to be talking through is regarding the coronavirus relief fund, the funding that's coming down to the state and local governments. You need to be working with your local delegation, your local mayors, your commissioners. It's very important that they understand. Don't just assume that they know that your public safety and 911 are doing interfacility transfers, that assume you need help. Never assume. They need to understand with clarity in your vernacular how you communicate with them exactly what is needed.
Excellent. So, by the way, for reference, everyone, we're being watched in the UK today. So remember, they spell color with a U. And if you want to convert from dollars to pounds, multiplied or divide by some factor.
And
A great program that came forward is the Payroll Protection Program, which I know many of our members participated in, and it made a pay period, it made a month possibly, but rules have changed up. Congress has acted on this. And I'd like to turn to Tristan North, who is our Vice President of Government Affairs for our association, Senior Vice President of Government Affairs. And Tristan, if you talk about that, and we'll pitch to roll to Senator Vitter to some comments reference the changes. Tristan.
Yeah, thank you very much, Randy. So obviously we saw the PPP program established as part of the CARES Act. There was also $349 billion allocated to the fund under that act. As Randy noted, it was very popular with a large portion of our membership. It was very popular with a large portion of businesses in the US. And the fund fairly quickly ran out to the point where Congress had to pass the PPP and Healthcare Enhancement Act, which allocated an additional $310 billion to the PPP fund. Actually, that was a pretty good bill for us because in addition to the $310 billion for PPP, that did allocate an additional $75 billion to the Provider Relief Fund, which obviously the Senator and Jamie and Asbel were just talking about. Since then, we have seen some improvements to the program as well with the Ppp Flexibility Act. It extended out beyond the 8 weeks to, I believe, 32 weeks, the amount of time that you can capture within the program and use those funds, as well as lessening the minimum percentage that had to be spent on payroll and you could spend on other items as well. This is obviously, as I stated, a very popular program. It has come under some scrutiny because, as we've seen in the press, a number of larger organizations that not necessarily were intended to receive funds did get some allocation there. So I think in this next package, we will see additional funding. I think it continues to be a popular program with both Republicans and Democrats, but we'll probably see some scaling back. And Senator, you may have a better idea of where things stand right now than I do, but my understanding is that they're looking to increase the number of employees, which establish a small business, bring it down from 500 to about 300 employees, maybe a little lower, and also really ensure that it is going to those businesses that are truly losing quite a bit of money as a direct result of COVID-19, and that folks will need to basically determine or provide information that they've lost between 30% to 50% of revenue as a direct result of COVID-19. I'll turn over to the Senator to probably give a little bit more perspective and context to the discussion in the larger debate right now.
Well, Tristan, I agree with everything you've said. The Payroll Protection Program has been one of the most popular and arguably one of the most effective tools that Congress has established to deal with the crisis. And it has had a real impact on a lot of small businesses. That's the reason the fund was re-upped in a very substantial way. That's the reason the rules were tinkered with and greater flexibility was established for small businesses. So I think you're going to continue to see the program perfected, tweaked, and re-upped in terms of funds. For that reason, it's probably a very good exercise for the association to think about how that can be done in the most meaningful way possible for our members, because I do think this is a program that is going to be here for a while and continue to be tweaked and continue to be funded.
And I'm not sure which of our panelists can answer this question, but the issue has been raised that this could be a taxable event. I don't know whether Tristan or Asbel or the Senator may have a response to that. So I'll turn to Asbel, latest you may have heard.
I will tell you that the information that we've heard from the offices has been indicative that they plan on addressing this issue. It's not just related to the PPP, but it's also related if you're a private entity, specifically ambulance, regarding the HHS funds that came through the CARES Act. That's also problematic and taxable as well. And understand that that is being worked on, and hopefully we'll see something in the next stimulus package, is what we heard yesterday. So the Senator or somebody else may have some different information.
Yeah, I think we saw in the House Democratic Heroes package that they addressed this issue. I think there was a standalone bill passed by the House that also addressed the PPP taxable issue. And I think Senator Cornyn has a bill very similar that would address this issue. So I think this is a very popular issue. I would be surprised, Senator, if this wasn't included if we do have a next coronavirus.
I agree with all of that. You can't assume anything until it gets done, but I would be shocked if this doesn't get done and it's made perfectly clear that it's not taxable because there is a widespread consensus toward that.
Great. We're going to drop onto another really interesting topic, and that is treatment in place. And I think we've all experienced that. People don't want to go to the hospital. Our 911 units or even our non-emergent units are going to facilities, they're going to people's houses, and we're staying, we're doing care, and then we're not transporting. Asbel has been active in working with this, as well as Dan Wilson on an education basis. So I'm going to turn to Asbel, and then we'll go to Dan, and then I'm going to ask Amanda. There are a number of questions that come in this to ask the questions to our collective group. So Asbel?
So this is probably one of the most exciting pieces that we've been working on as an industry as well, and has got a lot of media buy-in on this that Dan will opine about. But as far as what we've really been doing on an advocacy perspective, I'm just thankful that we've got so many key champions. Unfortunately, it was not addressed in the HEROES Act, but there have been numerous senators engaged in this, notably, I just hate to start mentioning senators, but we've had Senator Schumer, Senator Cassidy has really taken a lead on this. We've had Senator Grassley and others. I know that the Kentucky delegation has been working with McConnell's office on the importance of treatment in place, specifically around the public health emergency. It's extremely important to note that what we're working on right now in the short term is around the public health emergency. There's a lot of dialogue out there wanting to make some of this policy permanent at this point in time. The information that we're receiving, and I want to be as clear as possible on this, is it has to be related to the COVID response. That does not mean that it's related to treatment in place for COVID patients only. It's the public health emergency. A lot of dialogue's been happening with key committee staff on both sides of the aisle and on the House and the Senate side. So this is looking extremely promising to be able to do something, and then that would be effective, and what our hope is effective the beginning of this public health emergency, that it would cover your treatment in place, not from just the standpoint as the ET3 model has indicated, but also for some of the areas and some of the hotspot areas where there is certain state mandates or local mandates asking you to treat certain patients in place versus taking them to the ED, or you're having what individuals, they don't want to go to the ED because they think they might get COVID or something particular. It's covering that gamut is what we have been working with on the American Ambulance Association and really getting some good traction on this. So continue the advocacy. And I'm going to punt this to Dan to really talk about, because it's really been some great work that the Mercury group has done around this piece as well. Dan?
Great. Thanks, Asbel. First, it's great to be here with everybody. My name is Dan Wilson. I'm a managing director at Mercury. And really my job is kind of secondary to what everybody on this group is doing, which is media. My job is to raise the profile of these issues, to create some noise, and arm the frontline lobbyists with real fodder that they can go to lawmakers and their staffs with. And I have to say, I started this a few months ago. Of all of the issues, this is the one that's really resonating the most. I think it's the most obvious. It could be the biggest win for the industry and for the bigger EMS infrastructure in 20 years. You've got ambulance crews, like many of you, who are treating people in place in their homes rather than risking a hospital surge and just not getting paid for it. It's absurd. So whether it's the Wall Street Journal or Morning Joe or the Washington Post, again and again, I'm getting a great reaction from these reporters. And I think more than that, what I've learned, because I've had to educate myself about the industry. I'm fairly new to this. And a lot of these beat reporters are in the same position. They don't know how private interacts with public. They didn't even really know a private ambulance industry existed to begin with. So it's a very specific issue that's important to a lot of you, to all of you. but it's also been a great way to kickstart bigger conversations about the industry with these reporters that are going to start to come back to us again and again as a resource. So it's short term, it's a huge policy win if we can get it, whether it's in this next COVID bill or another mechanism. But long term, it's going to just pay off in bigger ways, because reporters are going to have an understanding of the industry that they really didn't have before. You know, I've worked with Kim with Superior, Hannon with Empress EMS, some of the bigger services. I think what I'd love to hear more from is the smaller ambulance services that are going through this too. So if you have great stories to tell, whether it's about treatment in place, whether it's about HHS sitting on these billions of dollars in relief funding that they still haven't paid out, or other issues, you know, that's why I'm here, to go make that case, to hear you tell your story, and together strategize how we can get that out to the press. And then that in turn helps Senator Vitter and Asbel and everybody on the front lines who are talking to lawmakers directly. And I'll have Amanda circulate my email afterwards. I really do mean that. If you have ideas, comments, that's really what I'm here for.
Excellent. So Amanda, I believe we have a couple questions associated with treatment in place. So if you want to put those out, we'll kind of let our experts speak up.
This one's specifically directed to Tristan. The individual would like to know, why are we advocating for treatment in place just during the public health emergency?
Sure, thank you. And I think Asbel addressed this a little bit in his discussion, and the need to really focus it on the public health emergency. There are a number of reasons, and I'm sure the senator can chime in here as well, but Senator McConnell, as well as others, have made very clear that any provision that is going to be included in a final COVID-19 package, or at least the Republican wish list, has to be directly related to COVID-19. And I think there's going to be a lot of pushback to keep out anything that tries to be a broader, longer-term policy. I think that's what, you know, he was kind of concerned with the HEROES Act, that there are a number of policies in there that aren't specific to COVID-19 or go beyond COVID-19. And then also, we really want to make sure that we are addressing the challenges that our members are facing right now, with the fact that they are already providing treatment in place and essentially not getting reimbursed for it. If we do this now and get it just for the COVID-19 public health emergency, CMS can almost automatically apply that and put it into place and let the regulation kind of catch up with it and have it retroactive to March 1st. It's different if it's permanent. You then have to go through the traditional rulemaking process. It would probably, even if we got it done now, would go into next year's proposed rule dealing with changes to the Medicare ambulance fee schedule. And our folks obviously just cannot wait. And there are also, obviously, when you're talking about permanent, you got to think about it in a much more thoughtful way and outside of the public health emergency, which is just going to take more time, which obviously we don't have if we've only got a couple of weeks before there's a final package potentially.
The only thing I would add to that is that we all have the goal of expanding this model permanently. This is just the means to get there. We're focusing on this emergency so that hopefully we can get this relief quickly, but then that can prove out the concept so that hopefully we can move the concept to a more a permanent place in reimbursement world.
Randy, we do just have a couple of questions that I'd like to relay to Asbel and Tristan. All of them centered around ET3. We've gotten a few folks expressing concern about the delay of ET3 and others expressing the importance of advocating for telehealth, treatment in place, and alternative destinations with one voice. So didn't know if Tristan or Asbel had any comments about the delay of ET3.
Asbel, do you want to tackle that one first?
Sure. I would suggest that the industry, there has been a stakeholder call that the Centers for Medicare and Medicaid Innovation had with the ET3 qualified individuals a few weeks ago. to just kind of do a listening session to get their understanding of should the delay continue. Do they want it quicker? And most uniformly commented that they would like it to be implemented as quickly as possible. So I encourage you, if you are an ET3, if you were selected for the ET3, that you continue to comment and continue to keep providing feedback to your project manager. If you are someone that now you did not apply and all of a sudden now you want to, is to go to the Centers for Medicare and Medicaid Innovation ET3 website and let that be known. They are looking at that feedback. There is a concerted effort and lots of dialogue that we have been having, that they understand the nuances around that, and that there are some differences in the rural areas that possibly there could be some flexibility around some of the original requirements as well. So we've been encouraging you on this platform, on the American Ambulance Association. You've been attending webinars, and just throughout, as we've been anecdotally talking about it, is to get that feedback going to the ET3. They are monitoring those comments and questions that you have as well. Tristan?
And just I agree with everything that Asbel just said. And just to point out, you know, it was great that the questioners really separated ET3 and telehealth from treatment in place, because I think a lot of people are confused when we talk about treatment in place and ET3. ET3 and what we may refer to as treatment in place or treatment and treat and refer is really not treatment in place. It really is more of a telehealth component. So.
Yeah,
So
Jamie,
this is
just
Jamie.
going to say,
just
Jamie,
wanted
you
to add-
have something here.
Yes, I just want to jump up and down about this one because it's scary to be a rural provider and how this will affect my revenues and not taking someone to the hospital. But, you know, we have placeholders out there to take care of that situation. But what I want everybody to realize is this is very important for us to have one voice as we go forward to Capitol Hill, because as you guys know, when you're trying to find money, they don't want to pay for your lost revenues, and they want to make it very specific to COVID-related incidents. And so that's why when we're on the Hill, we want to be very focused to what this is for, because we have those other things out there, ET3, telemedicine, all those things can be tapped in later. But if we can just get our foot in the door and hold it open and take care of this moment in time and not miss it, that's the biggest thing. We could screw this up if we have too many different versions. So let's be very specific at this point in time and saying this is what we need to help take care of this healthcare emergency across our country. And then let's expand on it as a group.
Great. More questions, Amanda? Great. We got 4 more topics we're going to talk about in the next 18 minutes. We're going to talk about FEMA. We're going to talk about PPE. Specifically, we're going to roll on a little bit talking about now the new thing we need to make sure is that as vaccines come out, that we're in the queue. We're going to talk about some more advocacy points and then stay on track. So FEMA Public Assistance grants, Jamie and you and Tristan can speak to this, but you know, first of all, we want to thank everyone who went to New York City and New Jersey who may be on this call. What a difference in life. And I know others are responding to other states now under different covenants and so forth. Jamie, your company between FEMA, you've done with us within an AMR, and then obviously somehow you get to hang out in the Virgin Islands. I'm not saying it's tough duty. I'm just saying, but if you could speak to the assistance grants. I had to, I had to take the shot, you know.
That's okay. I haven't even gotten to go down there. That's what is not fun about it. But as a private provider, many of us continue to struggle to get funds from FEMA on a state level. And this is where your relationships with your local county governments really come into play, because the bottom line from FEMA is that, you know, they will reimburse us for the activities that aren't covered by HHS or some other public entity to the extent that it was medically necessary to meet the emergency needs of our county. But you, one, have to declare it, and you have to have a county that will work with you. And so, and this is very difficult because each area has a different viewpoint of what it looks like to have FEMA assistance given to the ambulance provider. It's our goal at the AAA to make sure that all ambulance providers are treated equal in this and have the proper ability to get the funding that is out there. So anything that we want to see amended, whether it be with the Stafford Act for this public health emergency during this period of time, that all of those options for funding should be afforded to everyone, not just fire-based service, community-based services, those things. So we continue to push Congress, and Tristan can speak more to that, to make sure that we're included across the board. But what I will tell you is that for us to be prepared and protect as we continue to go forward, FEMA has to realize the role we play. And that's why your story in your local areas is so important, not only to Mercury to make sure that they're hearing it on Capitol Hill, but your relationships that you continue to build that will help us strengthen our argument. I don't think that they don't want to help us. The law just doesn't allow them to help us. And people need to understand what EMS systems do across the state. Everyone's not created equal. Everybody doesn't have a fire-based service, and that's a blessing for those communities that can have that. But a lot of the rural areas can't do that, and so we're left out. So Tristan, you want to talk about some of our avenues that we've looked at and where we found resistance and where we have some champions?
Sure, thank you, Jamie. And this is another challenging issue because we are, to a degree, opening Pandora's box in that there are a number of other private sector organizations, industries that work with FEMA and would also love to have direct access or direct eligibility to these funds. But we have heard from a number of offices very sympathetic because we are unique as emergency medical service providers, in which our industry is obviously comprised of public sector, private, and nonprofit, as well as others, that some organizations are eligible to go directly for FEMA grants and others are not. In particular, Justin Groves, our AAA vice chair of our Government Affairs Committee, has been working closely with Senator Tester's office. He is ranking member of the Senate Appropriations Committee with jurisdiction over the Department of Health and Human Services, as well as FEMA. He's indicated that he is interested in this issue. Obviously, it is going to be difficult to get a number of these provisions because the list is going to be tried to be targeted to more general groups and limited. But I think we had a really favorable ear with his office. And I know in working with NEMT that they have been working with House members on a Dear Colleague that would go over to leadership kind of supporting this provision. So there's quite a bit of activity in the industry on this issue as well.
Great. So let's talk about line of duty, that's PSOB. And just briefly, obviously, we at GMR, AMR lost 2 of our folks. Others on this call probably have lost folks. If it wasn't COVID, every day it's an at risk. And we have pushed this issue, and we've had some great response from some of the senatorial offices and senators over the years, but we've never quite got over the hump. But it is still on the table. It is still imperative that our people receive equal and fair and absolutely earned recognition in the defense of what a life is lost, be whatever it may means as part of our job. Rob Lawrence, who has many hats with our association, and then and he's even a Brit, we love him dearly, has been active on this campaign. So Rob, I'm going to turn to you to talk about the activities that have gone on to promote this. And then to some degree, I'm probably going to circle back Tristan a little bit to speak to our work we've done to date with this. So Rob?
Thank you, Randy. Firstly, to introduce myself, to comply with Amanda's instructions, I'm Rob Lawrence. I'm the communications chairman for the AAA, and also President Reinhardt tapped me to be the AAA's representative on the FEMA Pre-Hospital Task Force / listening session. Hopefully we can talk a little bit more about that later on. In terms of line of duty death, one of the things that I've been doing on behalf of the association in conjunction with a few other associations is to track those very sad line of duty deaths. And so far in the COVID pandemic, we've seen a total of 44 ambulance workers, I'm not including those that are this exclusively firefighter only, but ambulance workers deaths. If we start to filter that down, Randy, then the private and non-profit sector drops down to about 9 of those providers, sadly, were from the private sector. And of course, that means that it brings into some question whether they were actually covered in the line of duty death. And obviously that really gives some emphasis and focus on the work that, that we are doing. Tristan?
Yeah, so this is another issue, not necessarily tied directly to the Stimulus 4 package, but an issue we have been pushing on 2 fronts. One was to clarify that the public health emergency and a line of duty death from COVID-19 would indeed be eligible or covered under the Public Safety Officer Benefit Program. The good news is there that legislation actually was passed by the House under unanimous consent on Monday that would expand the definition to ensure that COVID-19, and not necessarily just when you can prove that it was caught, you know, that you got COVID-19 on the job and was a result of the death, that it does expand it to if you had COVID-19 and you're a public safety officer, then you would be covered by the program. So that was half the battle, so some good news there. But we had also sought to expand the bill to try to get private sector paramedics and EMTs covered during the public health emergency. Unfortunately, the House did not want to make any changes to the bill because it had passed under unanimous consent in the Senate, that they didn't want to kind of bog it down and make any changes that would then require it to go back over to Senate and then you know, potentially go from there. So we continue to press this issue, though, to make sure that there is coverage for the private sector, both in the short term with the public health emergency as well as in the long term, and make that permanent. And we do have Congressman Zeldin, Republican of New York in the House, who has introduced legislation on this particular issue to make it permanent.
Right. So we will continue to work on this. We will continue to make our case on the Hill. It's imperative. Rob, just in the interest of time, I would like you to go over, really, if you wouldn't mind, obviously priority access, we've talked that one till we're blue in the face, but could you pivot over to testing? And then the way I'd like to wrap today up is we have a few questions left, and then I'm going to run through our panel again for any closing comments and sales pitch on whatever they want to do. But Rob, if you would talk about the vaccine.
Thank you. And also to continue my introduction, Randy, I'm also the British judge in this reality show because every reality show needs one. So let's talk about testing for a second. It's one of the things that we are doing as an add-on, if you like, in this COVID environment, not only treatment in place, but also we are the people around town. We are conducting assistance to care homes. We are conducting, in some cases, contact tracing, and we're doing a lot of testing. And to a degree, that testing isn't being reimbursed. We're doing this as on a goodwill basis, and obviously there's some discussion around how we get reimbursed for that. The work that I'm doing in representing the AAA on the FEMA work group, of course, is to ensure that these things are on the radar, that we can talk about testing, talk about funding. And also, Randy, I'm just going to drift into vaccination as well, as we are seeing that there are a number of companies now developing vaccinations, and they're going to various escalating stages of trial. And the thing that we're also advocating for is to make sure that we're not forgotten as an industry, as a profession, and to make sure that we're also up the ladder in terms of priority for vaccinations when they do come along, to make sure that we can get our people covered as well. So there's both a funding and also a priority piece with that. Who was up next?
Well, I thought you told us that will be a major factor. We'll be getting out to everyone, and I think we'll be having a webcast shortly with Dr. Rock back on speaking to this, because you know the question is going to become, and to everyone on the panel, and to obviously to all of you on this call, do I get the vaccination now? Do I wait? What's my risk? So I think we'll make a very strong statement for that. Maria Bianchi's back on, but Maria, we're going to change the agenda just a touch, and I'm going to close out with you. So you'll be our last point. Maria dropped off. She's where she lives in Virginia is suffering a bit of a weather condition. So Amanda, we had a couple questions. We'll go over real quickly, and then I'm going to run through our panel for last comments.
Thank you, Randy. We received a question regarding the Paycheck Protection Program. Marion asks, will there be any consideration in the fourth bill to allow those who have already received PPP funds in the first round to receive additional funds due to continued impacts and reductions in call volume, et cetera?
Senator Vitter, I'll pitch that one to you.
You're on mute, Senator.
Sorry. Yes, I think there's very likely to be consideration of expanding the program in that way or comparable ways. As I said before, the PPP program has been very well received, very popular, very successful. And unfortunately, since it first passed, the crisis has only been prolonged. So I do think there is going to be openness to extending the opportunity and the benefits in one form or another.
Excellent. Any of our other panelists today have any other adds to that? Okay, another question. Do we have another one, Amanda?
We do. We have a couple more. Jeff asked, is there a prepared script or document that we can use to make sure we are delivering the same message to our elected representatives?
That's a very
I think
good
about any topic.
Yeah, Tristan, I will turn to you and Maria for that.
Sure, Maria, do you want to kick off and then I can add anything?
I think we'll stick with you, Tristan. I think she's still in the dark ages there.
Starting to work. Go ahead, Tristan.
So specifically on our immediate ask right now and what we're truly focusing on, because we can't have a laundry list of asks for Congress for the entire membership, that we are focusing on more funding and coverage for treatment in place. We will be rolling out a call to action later today, which will give the key points for folks to use with their members of Congress and exactly what message to convey. And this timing is critical as they go into negotiations and kind of finalize their different proposals. So that will be going out later today, and obviously encourage everyone to write their members of Congress immediately.
And Randy, again, this is Maria Bianchi, the Executive Director of the American Ambulance Association, in the middle of nowhere, Virginia, struggling through a severe thunderstorm. So my apologies. This is what live is. But I would like to just dovetail on what Tristan said, and collectively, because we're not live, it's not just AAA members on here. It's members of many different associations involved in ambulance services, emergency medical services, and mobile health care, as well as just patients in the communities that we serve. And I just want to dovetail on what everybody's been saying. We have talking points on every one of our asks, and we ask that everybody talk from the same songbook, because it's not just about making noise, it's about singing like a choir. When Congress hears from us and they hear different messages, it does become just white noise. But when we can all sing from the same page and we become a chorus, that's when our voices get heard. So if you don't know what our messaging is, our core message points, why we're advocating for the things that we are, regardless of what kind of patch you wear on your uniform, most of what we do, we all agree on. And our services need more funding. Our services need equipment to keep our employees safe. Our services need to be the well-respected public health and public safety entities that they are. And we are more alike than we are dissimilar. So as Tristan indicated, we have a call to action going out today, as well as we have a ride-along toolkit that you can use virtually, since we wouldn't want to do anything otherwise. But I just would like to implore everybody to pay attention to where we are similar, as opposed to all going up with different messages.
So I'm going to turn to Jamie, and then we're going to roll up here pretty quick.
Yeah, I just want to encourage everyone. I know that it can seem intimidating talking to your senator or your congressman, but it shouldn't be. Those are the folks that you either go to church with, your kids go to school with, they live down the road, whatever the deal is. And if you're uncomfortable having that conversation and telling your story, the American Ambulance Association would be more than glad to help you and just kind of lead you through the conversation. And we do that with a lot of folks because we want you to be heard because you have a story to tell. And I'm excited about that. So if you want some assistance in talking to your congressional delegation, we'd love to help you with that.
Excellent. So here's how we're going to close up real quickly here. So we're going to stay pretty close on time. I'll just run through each of you if you have closing comments, or you can just wish everyone a great day. Remember, wash your hands and wear a face mask. So Senator Vitter.
I would just underscore what's been said about getting involved. The power of the AAA is you, the membership, and the fact that you are in every state, in fact, every community represented by Congress. That is the power of the association, far more important than the consultants and lobbyists like me you happen to have working with you. So get involved, and when that voice is heard, particularly as a chorus, as Maria put it so well, that will generate results.
Ms. Pafford.
I'm here. No, I think that we have talked about a lot. And if you look at all of the topics that we've covered, the American Ambulance Association has their finger in every one of those things, trying to make sure that our voice is heard. And it's difficult to do it alone. But our number one goal at the end of the day is to make sure that we can help you take care of your communities. And we have a lot of asks, and we have to prioritize that. So I encourage you to go to our website and see what our priorities are and how we're sharing them with other groups, and that we can keep focused on the funding mechanism and making sure that Congress finds the ambulance provider in this next tranche of funding.
Mr. Montes.
I would just say, tell your story, be a doer, focus on the funding, wear your mask, and social distance.
Very good. And I want to thank Jay and Dan. But Jay, I want to turn to you for a last word.
Yeah, very quickly. So there's two pieces here that I'd love to just bring up. The AAA, we work with a lot of different organizations. The AAA is a fantastic organization, very well run, understands policy, understands messaging, understands how to move the needles. They've got lots of resources. Please lean on them, and we're here to help anytime. And echo what Senator Vitter said, the squeaky wheel gets the oil in Congress. Be loud, use the talking points that they provide you, but don't be afraid.
And Dan, again, to the Mercury folks, let me just quickly say thank you so much. The contacts, the work has been beyond outstanding. So it's been an honor to work on this project, and I have a funny feeling we'll have more as time goes on. So Dan?
No, and look, it's been a total pleasure. I think we all, even as outside consultants, recognize this is an existential crisis for ambulance services. So I would say, I talked a lot about national media earlier. I think what also really matters for lawmakers is local press. Don't ever think local press doesn't matter. They read it in their clips, their staff read it in their clips. So I'll just kind of repeat what I said earlier. If you have ideas, if you have a specific angle on treatment in place, on why you need the funding now, which everybody does, call me, email me. I am always available. I talk to everybody at AAA. It feels like almost on a daily basis. I'm here to help. That's why we're here. So thanks for taking the time to do this and hear us out.
Thank you. Tristan North.
No, for the sake of time, I think everyone else covered the key points. And just thank everyone for participating today, and do rate your members of Congress.
So I think we need to say thank you to two folks real quickly. Amanda, who has made all these webcasts work, and Megan Whitson, who's also, you'll see, she's just using the logo. Those two folks plus the other staff have done amazing things. I want to say thank you to everyone, but here's how we're going to close up. I'm going to close to our Executive Director, Maria Bianchi, who has been nonstop with us for a very long time and keeping us working well. But I want one other pitch before I turn to Maria. That is, if you're a AAA member, we're going to be asking you for your renewal. It's easy to turn us down by saying my volume's down, my business is down, whatever else. If you think about what our association really costs, we are nothing. We're a package of N95s at the peak of the pricing war. We need you to stay on. We need you to be part of our group. And so when we ask for the renewal this year, please do it. Please take the time to stick with us. And if you're not a member and you're watching today's broadcast and webcast, please join. We welcome members, and truthfully, when we all get together, we have one hell of a good time. We really, really do. So, Maria, I'm going to turn to you to close out, and thank you, everyone.
So 2 things, Randy. Thank you. You've done a great job thanking everybody, but I would like to thank you. You brought Mercury to the table for us. It's been a wonderful collaboration. And, you know, I would leave it with this. The association is its members. So you own us. You own this association. If there's something that you want to see education-wise, let us know. If there's a program you want us to be working on, let us know. If there's something that you don't like that we're doing, let us know. So this is your association, and it's only as good as the sum of our members. And so I encourage you to please participate. And if you need anything, the worst that we can say is we don't have that resource. We'll work on it. Thank you so much, Randy.
Well, before I stop, I made one small error, probably because I couldn't find his green card. Rob, you get the last word, and welcome to America.
Thank you very much, Randy. And my final word is, please remember, everybody, that change is affected by 4 little words. And those 4 little words are all those in favor. And in order to affect that vote and that change, you have to be involved. So please become involved. Please help us with the lobbying that we are going through. And remember, 4 little words, all those in favor. Let's make sure it's in our favor. Thank you, Randy.
Rob, I owe you a pint the next time we're together. Everyone, thank you. Wash hands, wear a mask. Have a great week. Bye-bye.